Hi, thank you. Today we're gonna talk about pronating a patient using a ceiling lift and the positioning cushions or pillows that you have to support the body and during the pronation.
So before you prone the patient, you want to make sure they're disrobed. You remove any EKG leads that they may have on the front. You also want to make sure that methoxes are placed in all the pressure points, the forehead, cheeks, both shoulders, flank area, your knees, and then the tops of the feet. When they're intubated, you want to make sure that all your lines and all your IV lines are up front. And then if they have a chest tube, a Foley or fecal management system, all those lines are down at the bottom.
Okay, we're going to go ahead and start. The first thing you want to do is make sure you have the patient on a turning and repositioning sling. We're going to take a second turning and repositioning sling and we're going to roll it up, and we're going to have the patient log roll away from us. We're going to slide the positioning sling underneath the patient, leaving a little bit less fabric on this side and more fabric towards the way that you're turning. So she's going to go ahead and roll that. Okay, so she'll be a little bit off-centered on this sling. You're going to take your overhead ceiling lift, focusing on where the highest weight distribution is in the upper body. You'll have 4 loop sets that are closest to the upper body. You're going to take those 4 loop sets. The first 2 that are in the middle, you're going to do loop 1, position 1, or the loop shortest or closest to the fabric. And same for this one. The second loop set on the outside of the 4 that are closest to the torso of the body, you're going to do loop position 2 of only the top sling. You're going to leave the bottom sling in place. And we're going to begin to slowly lift the patient up off the bed, sliding her towards you and over this direction. Ready? To the edge of the bed, as close as you can, safely. If you need to put the side rail up, you can. Okay, so we're going to continue to go up. But we're only going to go up a little bit, and we're going to ask that these 2 on this side use loop position number 4 or farthest away from the sling, and put that over here. Go. So as we continue to turn her up, we might need one more, just support her hip. Yeah, depending on how tall your patient is, you might need more than 1 set. As we're turning her up, she's going to go to her side. And at this moment, you're going to have your cushions or pads or wedges ready to go so they can be placed underneath her.
So these are all marked. Your upper torso, lower torso. They have a zipper on the bottom, so you want to make sure that the zipper is on the bottom of the bed. And you're going to place this across the chest. And then the lower torso will go across the hips.
Don't forget, if you're larger in the groin area, there is a plug and pull area you can pull out. And for women, C cup or larger, you should pluck out the breast section of the chest. These are unisex cushions you can use for either.
Okay, once you have those aligned, you have to remember that this side cannot see what's happening on the other side. So you want to make sure that your team is verbalizing if they need you to come up or down on the sling. So are we good to go on that side?
Good go.
Okay, so as we're going to lower her down, she's going to be half on the tops of those wedges. Once we come down far enough, we're going to remove this side. Okay, and so then once we lower it down, we're going to come back up And slowly, and we're gonna rely on this team to tell me what you need me to do. If you need me to continue to come up or down.
Keep coming up.
And she's gonna roll prone over top of the wedge pillow. She may not be exactly centered on the wedge pillow, so this is a perfect time to go ahead and support her as we readjust the wedges underneath her.
So the top wedge should always be clavicle or lower, not up into the neck section. The bottom wedge should be at the hip line or lower.
You have, go ahead.
When you go to move the arms, you want to make sure that you drop them down and bring them up following the natural position.
Placing the leg cushions underneath the leg to remove the toes from the bed to prevent shear and friction, skin breakdown.
And you'll also put the EKG leads on the back side.
And you want to tilt her down into a 10-degree to reduce facial swelling and relieve the diaphragm pressure so she's able to have full expansion. Thank you.